by giving a warm welcome to our esteemed panelists. So we have Dr. Ruma Bhargava, who is the Global Lead for Healthcare of the World Economic Forum, Edward Booty, who is the CEO of Reach 52, Professor Zamberi Zakawi, who is a consultant clinical microbiologist at the University Putra, Malaysia, and Luke Treloar, who is a partner and head of global strategy and national head of healthcare and life sciences at KPMG in Vietnam. I'd also like to give a warm welcome and thank you to our hosts from the EU-ASEAN Business Council and Sanofi, and also welcome those valued guests who have also joined us on the line today. Thank you for taking the time out of your schedules to join us today in discussing what is a very important topic, life course immunization. My name is Glenn Halliwell. I'm from an agency called GCI Health. We are a communications agency who have been supporting the organization of this webinar and also the launch of the white paper. And I'm honored to be your moderator today. Before we begin, I'd like to remind everyone that the Q&A function is available. So please share any questions that you may have at any point for our panelists. And what we'll do, we'll try to address some or all of those during the Q&A session of the program at the end, as long as time allows. So without further ado, let's get moving. Let's get stuck into the content of today's webinar. I'd like to begin by inviting Jennifer Setiawan, Advocacy Manager at the EU-ASEAN Business Council, to share some opening remarks and then go on to take us through the key findings of the white paper. Over to you, Jennifer.
Thank you, Glenn, and thank you to those who have availed your time to join us in this webinar today. So good afternoon, everyone. My name is Jennifer Setiawan. I'm the Advocacy Manager at the EU-ASEAN Business Council. I would first like to extend a very warm welcome to our esteemed panelists today, our supporting partner for this initiative, Sanofi, and our valued guests for joining us for this webinar. So as one of the largest global public health crises in modern times, the COVID-19 pandemic has changed our perceptions of healthcare services and preventive healthcare. More than ever, there was an increased recognition on the benefits of immunization for all ages to prevent infectious diseases and its severe complications, and to protect vulnerable populations, especially the elderly. At the same time, the pandemic unveiled the gaps in healthcare systems around the world and demonstrated the importance of investing in and strengthening preventive care policies. Prioritizing preventive care can create a resilient healthcare system that effectively addresses infectious diseases and wider health complications, an aging population, as well as other upcoming health challenges. Taking these learnings from the pandemic, we need to implement and advocate for preventive care as a core element of any healthcare system, such as improving access and uptake of life course immunization programs, which refers to vaccination throughout all stages of life, from childhood to old age. This is why the EU-ABC, with the support of Sanofi, have undertaken an analysis to examine the challenges and opportunities to implement and fund life course immunization programs, as well as the impact of the COVID-19 pandemic on prioritization and funding of life course immunization programs in Southeast Asia. This analysis has been informed through desk research and interviews with experts across Malaysia, Philippines, Vietnam, and Thailand. What are the underlying barriers to financing vaccination programs in national healthcare policies, and what innovative solutions are there to overcome them? The findings of our white paper will address these questions, and I'm very pleased to be able to share the findings with you during this session today. Next slide. The first key finding is that while governments are recognizing the value of preventive care and leveraging on infrastructure developed during the pandemic, experts suggest that there are remaining gaps where we can do more to successfully implement life course immunization across the region. Lessons from the pandemic are at risk of being forgotten. For example, resources and funding are now being redirected to address other initiatives in countries to rebuild economies, potentially neglecting the importance of sustained commitment, adequate funding, and strong political will to ensure comprehensive immunization coverage across populations. A key concern was that the success of COVID-19 vaccination program may create a false sense of security, which leads people to believe that vaccination efforts are limited to addressing this specific pandemic alone. This misconception may divert attention and funding away from other infectious diseases that require ongoing immunization efforts. And additionally, despite efforts to strengthen adult immunization following COVID-19, governments have predominantly focused on regaining setbacks in routine childhood immunization. Our next finding revealed that there is an overall lack of policy framework to fund and support access to adult immunization. While several countries have increased spending on preventive health and life course immunization strategies since the pandemic, this is still reported to be low. Studies on LMICs have shown that for every dollar spent on vaccination, there is a return of $44. Spending on preventive life course immunization per person falls short of the optimum spending of US $25 per person in Asia. And for example, in the Philippines, an average of US $1.15 per person was allocated towards the National Immunization Program in 2020. So the road to recovery from COVID-19 has resulted in significant hits in countries' economies. Economic activities have been greatly affected due to lockdowns, and large COVID-19 response packages have also resulted in increased fiscal deficits and debt levels, leading to less support on the financing of adult immunization programs. In Thailand, for example, vaccination rates are at 30% at present, as seasonal influenza vaccination is prioritized and subsidized for older adults in the absence of a formal adult immunization schedule. However, reimbursed influenza vaccines are only available during a few months of the year, despite infections occurring year-round. So the masses may thus not be motivated to pay for out-of-pocket for immunization services throughout their life course. More than 2/3 of senior citizens in Asia Pacific do not receive a pension, and many may rely on financial support from their children, just like 70 to 86% of people surveyed in the Philippines. Finally, life course immunization is not a silhouette approach. Sustainable funding and implementation of life course immunization programs require a whole-of-system approach. As populations age, disease prevention will become critical, not just for personal and societal well-being, but also for easing pressures on health systems. As such, the investment towards life course immunization should be likewise viewed across the whole system. Successful immunization programs require a holistic view of the whole ecosystem, from availability, access, promotion to the administration of vaccines to the public. This requires cross-sector collaboration, committed leadership, and sustainable financing towards the holistic ecosystem, so it can be sustained in the long term. While developing new financing mechanisms may have initial logistical and funding challenges, the returns and cost savings that life course immunization brings are significant. So, what's next? Given the low public spending on preventative health, innovative funding models should be explored to sustainably fund immunization programs in the long term. In this white paper, the experts propose a framework that addresses 4 essential pillars of financing in ASEAN: payment, programs, performance, and process. So the first P, payment, which encompasses funding that supports sustainable and growing immunization programs for populations beyond childhood, especially vulnerable populations such as the elderly, including new and more effective vaccines. Second P, programs, which includes funding to improve health literacy and vaccine confidence so populations understand the benefits of life course immunization. Third P, on performance. This refers to funding to develop and implement monitoring tools and surveillance systems to track vaccine coverage rates, supply, and demand. And finally, the last P, on process, which refers to funding to improve the efficiency and resilience of vaccine logistics and supply chains. So I'm sure all of you have been eagerly waiting, and if you'd like to read more about the 4P framework that I've just shared, and to read more about the key findings and our recommendations, you can download the full white paper by scanning this QR code on screen. To dive into more depth into these 4 pillars, we have with us today 4 distinguished guests who will explore what each of the 4 Ps mean and how they can help advancing innovative financing models for life course immunization. Thank you, everyone. Back to you, Glenn.
Thank you very much, Jennifer. Thanks for sharing the key findings of the white paper. A lot to digest there. We're going to keep the QR code up on screen a little bit longer. I'd now like to kick off our panel discussion to discuss the drivers and challenges underscoring the 4 Ps of life course immunization. So just a reminder, that's payment, program, performance, and process. These 4 Ps are the cornerstones that define the success and the sustainability of life course immunization financing. So how can they be applied to the future of immunization programs? Just before we get going, just to remind you all of who our panel are today. So we have Dr. Ruma Bhargava, who is the Global Lead for Healthcare of the World Economic Forum. Edward Booty, who's joining us. He's the CEO of Reach 52. Professor Zamberi Sekawi, who's a consultant clinical microbiologist at the University of Putra in Malaysia. And Luke Trillia, who is the partner, head of global strategy and national head of healthcare and life sciences at KPMG in Vietnam. So we welcome the participants. We welcome the panelists, rather, and we welcome all of the participants to submit questions in the Q&A box, which I'm sure after a global pandemic and many video calls, you're all very used to doing. And we'll try and take as many of those questions to the panel at the end. So to kickstart the discussion, I'd like to invite each of our esteemed panelists to share a brief introduction to themselves, as well as comment on this following question. Do you think that COVID-19 has changed how immunization programs are prioritized or financed? Why do you or why do you not? So I'm going to start with Dr. Ruma Bhargava to share her introduction and her comments first. Dr. Ruma.
Thank you, Glenn. I'm sorry. Good afternoon, good evening, everyone. I'm Dr. Ruma Bhargava, and I'm leading the health initiative at the World Economic Forum. Very interesting discussion and question posed by you, Glenn. I would say that COVID-19 has moved the needle, at least it has sparked the conversation that why we should be bringing life course immunization on the center stage. But as the urgency of COVID-19 has faded, I would say the priorities have shifted, not only at the legislative level, but also at, I would say, both at the provider level as well as the recipient level, being as the patient himself. Why should one approach the health systems, as is also one of the findings in the white papers you have released. Also, the age group, what we are targeting in life course immunization, especially the adults, when it comes to being what should be the focus for the legislative, for the governance and the policies, it is always the chronic diseases. So I would say to make life course immunization at par with focus on the other diseases which this age group faces, that is something we need to work on a little more.
Thank you, Dr. Ruma. I'd like to pass the floor now to Edward Booty.
Yeah, hey, good afternoon, good morning, everybody. I'm Ed, so run an organisation called Reach 52. We focus on rural health access across 7 countries in Asia and Africa, training up health workers to collect data and then run really sort of data-driven public health campaigns for vaccine access and sort of a number of different disease areas, diabetes, hypertension, etc. Has things changed? I guess the way I'm actually maybe not thinking about it so much from a financing view. I think from a focus point of view, you know, community health workers on the front line, lots of vaccines missed, especially in children during the pandemic. I would certainly say there's been more focus on catching up, actually, is what I was thinking as you said that question. You know, those clearly missed 0-dose children and this kind of, you know, significant problem that's occurred. So operationally feels like there's been some, you know, necessary additional efforts to catch up in terms of that sort of macro picture and financing. Not so much my area of expertise, but haven't, you know, spotted anything hugely seismic that is, you know, definitely needed, but also don't quite work at that level, if that makes sense. But certainly seeing, you know, more activation at a community level for sure.
Thank you, Ed. That's really interesting. Thanks for sharing. Over to you, Professor Zamberi.
Yeah, thanks, Glenn. I'm Zamberi Sekawi. I'm the consultant clinical microbiologist at University of Putra, Malaysia, and also the chairman of the Malaysian Society of, Malaysian Influenza Working Group, which is the interest group in under the Malaysian Society of Infectious Disease and Chemotherapy. So our group actually now is focusing on advocating government-funded influenza vaccination, particularly for elderly first, and then eventually for other vulnerable groups. So that is a work in progress. With regard to the question whether things has changed after the pandemic. Obviously, in terms of awareness, there is tremendous awareness about the need for vaccines to prevent diseases, and also in terms of Ministry of Health, also they're aware that maybe they should think of investing in vaccines for life course immunization. There have been my Ministry of Health colleagues has been talking about this as well, which was actually non-existent before the pandemic. So in terms of awareness, yes, and I agree that there's times to catch up with zero-dose children and so on, things like that. And in terms of funding, that is a very big question that we need to explore, mainly because there are so many competing health priorities that they need to deal with. So that's just my introduction. Thank you.
Thank you, Professor Zambari. Finally, I'd like to invite Luke Trillier for his comments as well. Luke.
Yeah, thank you very much, Glenn. I really appreciate the time and effort put into the white paper. It was very good read. Yeah, so in my role, I work with government bodies and global providers that are trying to expand access to quality and affordable care, mostly here in Vietnam and across Southeast Asia also. So it's the trifecta of quality, access, and affordability for the most number of people possible. And COVID really strained that. And I think that now in a post-COVID world, we're dealing with a couple of things. One is heightened awareness of the healthcare system. So from the government perspective, we're seeing a renewed interest in microbiology in terms of nosocomial infections, in terms of the propagation of diseases and how quickly this stuff gets out of hand. But also from on the government side, we're seeing we still have a residual amount of COVID fatigue, for lack of a better term, and nobody wants to say, we did COVID, now let's go do something else that is equally expensive. That's not a recipe for success in a conversation with a policymaker right now. But you can harness their heightened sense of awareness and bridge that with the general population's awareness of their own health and awareness of their own fragility. People are subject to conditions, whether they're old or young. So on a population level, I think we're seeing a rise in awareness, and hopefully that could be bridged with the government's ability to fund it.
Okay, thank you. Yeah, I think we can all agree with you that we're all a little bit COVID fatigued. So thank you very much, all of the panelists, for your introductions and the reflections on that initial question. We're going to now dive a little bit deeper into the areas included within the white paper. And we're going to look at the overall financing aspect of life course immunization programs. And I'm actually going to address this in reverse order. So I'm going to start with Luke for this discussion. So Luke, obviously a lot of things had to change during the COVID-19 pandemic. Have you seen any COVID-19 vaccine sort of administrative initiatives that have been then deployed and become permanent efforts for broader life course immunizations within Vietnam or indeed beyond Vietnam?
Yeah. So Vietnam is kind of like the student in the classroom that studies other people's homework. So we're able to look how other markets have cracked this nuts and then apply it locally. So Vietnam is studying other markets. We're actively looking at how other markets have done it. And there are basically three big levers that we can pull. There's either the at the government level, so government's providing more access, and usually means more funding. Expanded participation of the private sector, and increasing efficiency, so lowering the burden of administration within the system. So we call it grease in the cogs of the machine. So on the government side, there are lots of really good examples that have emerged recently. So Singapore providing expanding their funding for their adult life course immunization programs, expanding over 65 flu shots free for everybody. Thailand expanding their national adult immunization schedule for a wider variety of vaccines for adults, and providing those largely free of charge. So there are lots of examples at a governmental level, but also the government can't do everything, right? The private sector has to step up. The private sector has to be a partner with the government, either as an independent actor or as a formal partner in a public-private partnership. And there's some really good examples that have come out of this. Malaysia has launched an initiative where it will backfill some of the expenses for insurance companies for immunization for adults. The Malaysian government's recognized that if it makes an investment directly into the insurance companies, that it'll have an outsized impact on the economy through reduced wages, reduced lost days of work, and so forth. And on the other end of the spectrum, in Africa, we're seeing some very cool examples on a smaller scale in Kenya and even Chad. Kenya has a very interesting application that they've launched to allow the private sector to organize healthcare and link patients with providers, and they call it MTIBA, TIBA. I always call it TIBA, and I'm not sure that's correct or not. But that's a really cool initiative to allow the private sector to play an active role and allow people to have direct access to their health care. And this really accelerated in a post-COVID world. So there's, in what I call the grease in the system, the grease in the gears. That's more than the developed countries like Australia is allowing pharmacists and to work to provide vaccines directly in the pharmacy. In a country like Vietnam, it's surprising that this would make a huge difference. So rather than going to a doctor's office and have the physician operating at the bottom end of his license, go to a pharmacy or public health facility to do mass vaccinations or routine vaccine top-ups. So lots of things that Vietnam is studying, and hopefully we'll be able to implement some of these locally.
Great to hear, and some really great examples there from all around the world. And any sort of learnings from, I guess, other areas? So if we look outside of vaccination, immunization, any other kind of interesting financing models or holistic financing examples that you've seen from programs outside of the vaccination space?
Yeah, so there are lots of really interesting public-private partnerships or patient access programs with the pharmaceutical companies that are emerging. There's very interesting examples with some of the big pharma companies for using AI to means test patients to allow direct access to pharmaceuticals. That's not just immunization, but just pharmaceuticals in general. So like an example of how the government is working with the private sector to provide access to people who otherwise wouldn't have those drugs. For the financing models, it's both financing and awareness, right? So the multilateral organizations are providing direct support to local institutions for financing, but also helping to drive awareness, and that's going to be one of the big things for lesser developed countries like Vietnam going forward.
Okay, thank you very much. Thanks, that's really interesting. I mean, while I think governments and I guess society in general are obviously recognizing the value of preventative care and leveraging on some infrastructure, as Lucas has shared, that was developed during the pandemic, I think there's a lot of experts suggest that there are huge gaps still to successfully implementing life course immunization across the region. Ed, I wonder if we can turn to you now. Could you tell us a little bit about the key challenges and also opportunities for vaccine distribution and supply in the Southeast Asian region?
Yeah, sure. So, yeah, just noting my perspective, very much rural health, outside of cities, Philippines, Indonesia, done work in Cambodia, Myanmar as well as actually some of our big immunization work as well, conflict-affected regions. Supply chain, I won't go through the basics, getting stuff to rural areas, especially with cold chain, is harder. However, arguably, significant investments in public infrastructure due to COVID and, other vaccine funds, cold chain equipment is present. So, there is a cost implication in principle, but, I've been to a lot of rural health centers and you often see the big vaccine fridges there and UNICEF logo on the side or whatever it might be. So, some of these challenges are being solved. I do think there's a difference, as sort of Luke said, in a different way. You know, the last mile, a rural health centre 2 hours, 5 hours from Manila doesn't mean that you're going to the most rural, and most people wouldn't want to sit on a bus for 2 hours to go to a health centre to get a vaccine, etc. So how you go from the health centre to the community, you know, not necessarily a pharmacy, but to a, you know, not a primary health clinic is really important. We have done work in that. It does really help. So that's just trained community health workers and just the ability to go from the clinic to closer to where the patient is, and yeah, that could be a pharmacy or school or whatever a suitable facility might be. I think the other big thing that we do see, work with a number of vaccine companies, but also non-profits and such. Supply is one thing, but demand's the other. So, you know, vaccine hesitance, vaccine confidence, you know, the misinformation on social media, it's real. I mean, we have communities in some of these rural areas with 12% vaccine coverage rates. You know, the target is 80, right? So we're talking 12% versus 80. So like with much health messaging, like with much misinformation, I kind of feel that, I wouldn't say it's amplified, but you know, there's significant need for awareness generation. Supply is challenging, but I actually think that an easier, not easier, it's a more solved part of the equation, and equal weight has to be put on to really awareness education, you know, driving the uptake to make sure that the vaccines get pulled down to the patient level effectively, or patient/community level, citizen level.
Sure, I think that's really interesting. You know, it comes up across all vaccines, right? The misinformation, you know, community education, you know, it's such a huge part of it. I mean, just going back a little bit to you know, the supply chain and the logistics of supply chain. I mean, you know, what is from your perspective in those sort of more rural and last mile communities, what is missing in terms of, you know, funding there, and you know, what is needed? What do we need to advocate for more of, if you like, even now post pandemic?
Yeah, sorry, I did sort of not answer the supply chain bit as well as I should have, perhaps, but yeah, valid. Again, processing it rationally. I think two things I see a lot of, as I say, you know, community one, let's just say there's two villages side by side. One could have 12% vaccine coverage rate, one could have 40, one could have 80. Better data is important. You know, you look at national averages, that region could be 60%, let's just say. I'm making it up, but community one's very different to community two. So better data on who needs what, I think, is really important. We saw this in COVID. We use a tech platform. We've had that used for COVID tracking because people didn't know who vaccines were going to, and you know, there was the need to vaccinate the most vulnerable first during COVID. People didn't, you know, the government, you know, bluntly, didn't know who the older people with diabetes were, so they relied on our data to identify the most vulnerable who should get the COVID vaccine first. So better data for demand forecasting and planning with micro targeting, I think, is really important, especially to stop wastage and other issues. So I think that's really important. Tech, AI, you know, whatever can have a huge impact on efficient supply chains and pulling down the right amount of stocks to the right place and so on. More funding, of course, needed for that. And then, yeah, I guess just from my perspective, continuing to invest in the last mile. I mean, I don't like to say things are easy, but when I look at the health system, cities are easier, right? You've got the big warehouses, you've got the infrastructure, you've got the roads, you've got the big pharmacies, you've got the big hospitals, etc., etc. If we are really serious about health equity, if we are serious about UHC, we need more money to you know, cater for the harder challenges of going to rural places. And that's the same in the US and Vietnam and Cambodia, right? I mean, it's somewhat easier to serve urban metros than significantly more rural areas. So yeah, clearly more investment, focus, awareness, education, funding needed, and really should be data driven, because there will never be enough resources for everybody. So my view is the best we can do is, you know, optimize it and minimize wastage as we advocate for funding as well, if that makes sense.
It does. No, thank you very much. Yeah, a really comprehensive answer. Thank you, Ed. And actually, you've very helpfully, I guess, segued me over to Dr. Professor Zamberi. So when it comes to infrastructure, data, surveillance, obviously we understand, and from what Ed has said, that they play a very important role. Has COVID-19, in your experience, has COVID-19 changed the way that we view and manage and then subsequently fund the prevention of infectious diseases?
Thanks, Glenn. So, of course, COVID-19 has taught us that, at a grand scale, how do you manage a pandemic? And we learned a lot in terms of importance of surveillance, and also surveillance will lead to immediate action and also intervention. This is very important. So there's the lesson learned there is that we can use this kind of methodology to address the whatever vaccine preventable diseases, for example, influenza. So there's a need of comprehensive surveillance in order to convince the policymakers, how the vaccine later on will have impact on reducing the number of cases, for example, or deaths, and also even we can also get the data and analyze other data at the regional or even global. So the systematic methodology is there. So how do you actually repeat that or replicate that to the other vaccines? So that is the big challenge now. To do that, you need resources, you need even money. That's where finance comes into picture. But we have to start somewhere. And the lesson number one that mentioned by just now was presented is that we will tend to forget later on what we have learned during the pandemic. So we are at risk of forgetting. I see that as urgent need. And right now we have to leverage on the heightened awareness of a vaccine as a means of cost effectiveness to prevent diseases. And hence people are talking about life cost immunization now. So we need to move fast and think of something how to finance this.
And what other I guess, how do we in your view, how do we advocate for funding, when it comes to things like data collection, monitoring, surveillance? So I guess in a government size, maybe these are not important things necessarily to put funding towards. How do we advocate for those aspects? Yeah,
of course, it's chicken and egg situation. Government may not look at it as the important thing to invest, because they are now thinking of addressing the urgent needs, like, for example, the rise in non-communicable diseases in the region, which is really going into another pandemic, for example, like diabetes and hypertension and heart diseases and so on. So that is already really a burden for the government to explore. And with, my worry is that the government will look at it as just status quo. We don't have to do anything, just treat it how it is. We've been treated pre-pandemic. So we have to come with innovative financing. I think there's a big role from the private sector that they have to come in and work together with the government. Probably they have to pump in some funding mechanism, help in terms of how to do surveillance, good surveillance for example, flu. In Malaysia, for example, we don't have a proper surveillance system apart from the basic surveillance to WHO, for example, for the purpose of collecting the strains and a vaccine a decision on which particular strain to be in the vaccine. So that is just a basic surveillance. But if you talk about a proper comprehensive surveillance, like in Australia, in China, and in US, so that's the way to go. So who's going to do that? It takes a big toll to government to actually implement that comprehensive surveillance. So there's a role of vaccine companies, for example, to complement this. They probably have another surveillance system which are able to detect or capture all this data from that particular aspect. And I see also a role from the universities in terms of research to chip in and how to make it, analyzing of data and so on. So tripartite kind of like collaboration is probably the way to go. Everyone has to work together.
Fantastic. Thank you very much, Professor Zamberi. So I guess, and now we're going to turn to our final panelist. So, the pandemic uncovered huge gaps in healthcare systems around the world, some more alarming than others, I guess. What COVID-19 did demonstrate is the importance of investing in and strengthening healthcare systems. Dr. Ruma, your work currently looks at global health policies to strengthen healthcare systems, including for communicable diseases. Taking those insights into what we're talking about today, which is life course immunization ecosystem, what are the elements across that spectrum that would be most valuable for us to invest in? So, for example, we just heard from Professor Zamberi about monitoring and surveillance systems, following vaccine uptake or awareness programs, as Ed brought up before. Be great to get your view on that now.
Sure. Thanks. Very valid points raised by my fellow panelists. I would not repeat on the ones on awareness and education and monitoring and surveillance, just adding on to the bit that I would say that when we move from childhood immunization to adult immunization in this whole course of life course immunization, we also need to stress on how we are dispelling myths against adverse events following immunization, because as a child, there are different adverse events, and as we move on to the adult stage, as the patient, as the recipient or the patient, I would say, is suffering from other diseases as well, then how does the government invest in dispelling those myths that the immunization being taken up does not cause any harm to the patient, both at the people who are administering the vaccines as well as the recipient who is taking it. Similar would apply to the monitoring and surveillance data, how we can collect that data real time and plan for the better. One more thing I would like to focus on this particular area is how do we train our workforce well, that how efficient they are, because I feel, especially in the low resource settings and the peripheral and the rural areas, the people who are administering the vaccines, the frontline health workers, they are the first point of contact of the community with the health systems. So how well they are trained, not only about administering the vaccines, but what are the diseases which the community is being prevented by taking the vaccines, because they are the people who give the community the knowledge rather than going to the medical professional first. So I would say strengthening that particular cadre would really make a huge difference as we talk about strengthening the system. And of course, then there would be, I would say, the role of the private sector and the role of civil society, which would come into being. But three of the important pillars: how do we dispel myths against adverse events against immunization, collecting real-time data to not only plan our current program, but monitoring and evaluating it in due course of time, and how do we strengthen the cadre of the frontline health workers when it comes to training about the diseases, the whole life course immunization, as well as administering it.
Okay, I understood. And so my next question, I guess there could be a little bit of overlap here in what you've just shared, but you've done some work in conceptualizing strategies for both pediatric and maternal immunization programs. What learnings do you have from those areas, which we've already heard are maybe doing better, that we can take to strengthen, approaches to life course immunization programs?
Right, sure. I think, of course, adding on to the points which I have already made, I would also say that equitable access to vaccines. I think Edward made a very valid point that in cities it is very accessible, very easy to approach immunization because you have all the infrastructure in place, you have the roads, you have vaccine storage, you have the proper robust cold chain. But when the needle shifts towards the peripheral and the rural areas, how well are we able to replicate the same kind of services? That is very important. How are we able to dispel vaccine hesitancy? That is very important with respect to the socioeconomic strata, the race, the religion which that particular community belongs to. That is very important. How are we prepared with respect to emergencies. So as we have seen in the during the time of COVID-19, we had actually sidelined, or I would say it was less of a priority, childhood immunization. We have there were gaps in childhood immunization because the whole healthcare system was focused on COVID-19 vaccination. So I would say, how do we maintain a parity and a balance between the two? How we should be keeping us aware and robust for any emergency which comes up, be it epidemic, and endemic, or a pandemic, and focusing on routine immunization as well. So, and also I would say, how do we adapt our policies and legislation as we face the threat of new health emergencies? We have seen good examples that how the governments, not only at national level, but coming together at international level, collaborating and adapting their policies, not only in terms of trade, that how, vaccines from one country could be shifted to the other country. There were certain challenges and gaps because we saw that there were models which had come up like COVAX, but then there were certain glitches. So learning on all these, that how we can collaborate, having more adaptable policies and legislation, so that whenever emergency strikes up, or also I would say in the course of routine immunization, how we could enhance the coverage, not only looking at our specific geography, but having a global outreach. So I would say those would be the key factors.
Okay, thank you very much. I guess one final question, probably just before we go to the group Q&A, the panel Q&A. During the COVID-19 pandemic, Dr. Ruma, we managed to successfully get a huge proportion of our at-risk or high-risk population vaccinated quite quickly. Now, obviously, that was under sort of emergency conditions. But are there any other remaining lessons from that process that we could apply to life course immunization beyond pediatric and maternal vaccinations?
I would say advocacy is very important in that particular age group, because vaccines are a preventive approach, unlike and especially in that spectrum of in that age spectrum, when we are targeting, preventive approach is something which takes a secondary seat even for the patient itself. They are dealing with the other diseases at that particular life stage, as I mentioned in the previous question as well, the chronic diseases. To have them convinced that taking a preventive approach towards the disease which they are not currently undergoing, but they certainly face a threat to, I would say that that would be the key area to focus on.
Okay, understood. Thank you very much. Well, thank you to all the panelists for your contributions so far. So we've got around 15 or just less than 15 minutes remaining. I'd like to now just try to address some of the questions that we've received via the Q&A function while we've been online. So give me 1 second while I just switch my view. I'm gonna pick a panelist, if that's okay. Pick on our panelist. If one of the other panelists believes that they could also have a view they'd like to add on, please do let me know. So let me start. This one's for you, Ed. As advocates in health and life course immunization, what role can we play as individuals in advocating for the prioritization of life course immunization funding?
Yeah, that's an interesting question. I was actually going to add some bits around that coincidentally, but didn't want to talk for too long during previous comments. I mean, I think, yeah, notwithstanding vaccine hesitancy, vaccine confidence, there is also, huge awareness, right? We all know what vaccines are now, generally speaking, even in the most rural areas. And, it's a bit of an abstract example, but I got my first flu vaccine this year because, I obviously understood before I was never vaccine hesitant, but additional vaccines are a good idea. I paid for it out of pocket. So, across the strata, there is more community awareness. In reality, yeah, we all know, right? Political mandates shape funding. Political mandates are influenced somewhat by individuals, generally by civil society. So I think, in reality, the idea of Ed saying in Singapore, whatever, UK, pay for more vaccines as an individual, I mean, we're aware, but the mechanisms to engage government as citizens is generally through, a range of civil society organisations. Sorry, I was playing around with that in my head earlier. Clearly more awareness, clearly has to be on the policy agenda for funding, going on Twitter and hashtagging government, I don't think is necessarily going to do it. And that's probably where the role of, strong civil institutions representing, policy organisations, etc., are essential. What that means, I don't know, more funding for them, the ability for them to do research to bring to government, perhaps private sector has a role to work with them. I don't know, but certainly agree citizens can play a role. Capturing that awareness is key, and it's going to be essential to shape policy around citizen needs / demands, as a good government should. So, yeah, very valid question.
Thank you very much for your answer. And Ed, I believe we might have to lose you in a minute or two. So I just want to say thank you very much for your contribution to the discussion today.
Yeah, no worries. Actually waiting to board a flight, but yeah, it's a bit delayed as it happens, so I'll stick on till the end. But thanks for acknowledging that. And yeah, I'm 20 minutes late, so I'll be on for 10 minutes still.
Okay, thanks. Okay, so let's another question. This one I'm going to.
Hey, Glenn.
Luke.
Dr. Zambari has his hand up. I just want to.
Oh, apologies. I didn't see that. Sorry. Professor Zambari, please.
Yeah, just to add on the question, to follow up on that one, is that, we have not seen public actually asking for the vaccines. So this is going to be a big problem, because the policymakers says that is this coming from the professional societies or advocates, but then the public themselves are not really looking at it as something that they really want. And we're going to have a race of, even though in terms of policy is recommended, but then the uptake will be very low because basically there's no commitment from the public side. So public awareness is very important. We have experienced this with putting in pneumococcal vaccination in our childhood immunization. It was not part of the schedule. So eventually we did a lot of advocacy work, and eventually the public realized that it is really important vaccine. And they make some noise to the government and eventually get it approved. So there is one factor that we need to do a lot of education to the public, stress to them that these diseases is like COVID, it kills and hence the need for vaccination.
Okay, thank you, Professor Zambari. Thank you for cutting in there. So Luke, I guess this one's for you, Luke. So we're hearing about all the different potential areas we should focus. Obviously, we have finite resources and funding available in the countries across Southeast Asia. Based on your experience, which elements of a life course immunization implementation should we be prioritizing to see the best outcomes?
Yeah, thanks a lot, Glenn. I just want to actually first react to something that Ed said a few minutes ago that was really, really good for somebody like myself who manages emerging markets based in Vietnam. There's a desire within a healthcare system to build the heroic, massive facility in the center of an urban area. But for Vietnam, 60-70% of the population lives outside of a city. 80% of the healthcare investment, infrastructure investment, goes inside the city. So it doesn't take a math genius to figure out that there is a mismatch between the population health expenditures and the populations that are being served. So from a adult life course immunization perspective, we have to think, what's the most good we can do for the most number of people to expand access to preventative care at an affordable price. And then that's going back to my original comments on a combination of government initiatives of funding adult immunization programs like we've seen in other markets like Thailand and Indonesia. Also, multilaterals, NGOs that are actually working in those communities, building on top of their infrastructure, but also working with the pharmaceutical companies, the Sanofi's and the MSDs Now the new players are getting into the space for helping expand access to their critical care and their pharmaceutical products, and particularly their vaccines, to the communities that need them, that might be outside of their existing supply lines or their partnerships. So it's going to take a lot of flexing of companies and organizations being more flexible than maybe they're used to in the past. But we've seen other examples around the world where this has worked. So the model is there, and I think it's, at least for Vietnam and other markets comparable, it definitely can be done.
Thank you. Thanks, Luke. Maybe I think we've got time for maybe one last question. So I'm going to go to Dr. Ruma for this one, please. So we often see the most marginalized or vulnerable communities facing, we talked about rural communities just for now, but other marginalized and vulnerable communities facing inadequate access to particularly immunization services. How, in your view, how can we ensure that our life course immunization programs best reach those other marginalized communities? And I'll say for now, not just thinking about rural communities.
Yeah, sure. So I think first, to improve accessibility, I would say we could also make the use of telehealth services, having vaccines being available at the doorstep of the community. Also, tying up immunization services with the other health domains. So the other as the adults would be suffering from the other chronic diseases, which I've been repeating every time. So if then tying up immunization with the diagnostic tests and treatment of chronic diseases like diabetes or hypertension, that would save not only the patient's time, but would also help us compound up the benefits what we are able to leverage through our health systems. It would also lessen the burden on our healthcare systems, whereby complementing the benefits of the services which we are going to provide for two diseases, we are able to not only reduce the expenses of the healthcare systems, but are also able to deliver to the patient multitude of services. This is what I feel should, when we are reaching the marginalized, especially to increase the accessibility in those areas.
Thank you. Okay, so we've only got a few more minutes left in our time together today. I'd love to go around for further key takeaways, but I think in the interest of time, I'm going to do a brief summary of what I've heard today. So, I think we're seeing a great opportunity for Southeast Asia to further prioritize and fund life course immunization programs, especially, with the backdrop of an aging and I guess rural population, and there's going to get an older population over the next few decades. While there's plenty of lessons that we can apply from our pandemic days, there needs to be strong political will and commitment to sustainably funding and implementing life course immunization programs. And as several of our speakers have mentioned today, this needs to be supported by a whole of system approach, including collaboration across the industry, grassroots organizations, NGOs, public-private partnerships, collectively working towards ensuring that Southeast Asia ages healthily and protected from infectious diseases. I'd like to thank our panel. So thank you, Ed. Thank you, Professor Zamberi. Thank you, Luke. Thank you, Dr. Ruma, for joining us on the panel today and discussing these key pillars for sustainably financing frameworks for life course immunization in this region. Before we close our event today, I would just like to invite Ada Wong, who is the Head of Public Affairs and Vaccines for Asia JPAC at Sanofi, to deliver a few closing remarks. Ada, over to you.
Thank you so much. Sorry, I joined the webinar late. I'm on the roll. Hopefully you can still hear me clearly. First of all, I'd like to thank you everyone for joining the webinar. This is a very important topic, not just for the countries, for the society, for individual as well. And thank you for all the panelists taking time to share the insights with us. We are very happy to support this white paper initiative once again. It's our second time to do that, alongside with EU-ASEAN Business Council, to have better understanding the importance in prioritization, financing for life course immunizations, particularly in Southeast Asia region. Since we last looked at the existing live course immunizations program in Southeast Asia 3 years ago, just at the beginning of COVID-19, and we believe that it's time to take stock to understand where are we now and how can we do better. Don't wait until the next pandemic to come, and we need to fundamentally strengthen the live course immunization. Hopefully, you just like me, very inspired by the panelist discussion today, and so much we need to work on together. And there's no single responsibility, not just government, private sector, NGO, public institution, medical association, all we have a role to play, and we can work together to support this important journey. Thank you once again, and back to you again.
Thank you, Ada. So thanks, once again to everyone for joining us today. I hope you found the discussions helpful in developing solutions to advancing life course immunization funding in your country, wherever that may be. You can download the full white paper by scanning the QR code, which is just coming up on your screen right now. And please do not hesitate to contact the organizers if you have any questions. I'd just like to ask the speakers to just stay behind for 1 minute after we close the webinar. Thank you again, and good evening. Okay, just have the speakers now. Yeah. Right. We're just going to do a quick photo, guys, of so we can capture all of the panelists. If that's okay. So if you just keep your camera on for a few moments and try not to move around too much, we'll capture a photo and then we'll leave you to your flight or whatever else you've got next. Okay, apparently that we're all good. Thank you very much, everyone, today. Thanks for making it a seamless webinar. Ada, any last words from you before we close the call?
Thank you so much for taking time. I think it's very important initiative, and hopefully you can share that with your network. And no one can do that alone, and your effort, your commitment is definitely a huge role to play. And thanks again.
Pleasure.
Yeah, thanks, Ada, for driving this.
Yeah.
With,
Thank you.
Aussie Business Council. Very good.
Yeah, cool.